And so the states continue opening up bit by bit, capacity by capacity. It is not exactly the way we were, but closer to the way we want to be. Welcome, everybody. I'm Neil Cavuto. You're watching Cavuto Live, and scenes around the country today as dozens of states now begin to take measures, tentative, cautious measures, to reopen. What that's meaning in restaurants is that in the best of cases, they're open at about half capacity. When it comes to Texas, eventually at a quarter capacity. They see how that goes and they lift the capacity. Do the same when it comes down the road to salons, barber shops, tattoo parlors, all the rest that will phase in depending on where you are. It's all part of a hope, at least, to get America back to what it was or closer to what it was. Steve Harrigan has the latest now from Atlanta. Steve.
Neil, the count as of this morning, about 12 states have pretty much fully reopened their economies with some restrictions. By the end of another week, that number is expected to double. So from Florida beaches to Texas restaurants, people are getting back to business with restrictions. That's not the case in the beaches of Orange County, California. Judges upheld the governor's order there to keep those beaches closed. The governor angered after crowds gathered on those beaches a week ago. In New Jersey, despite the fact that the state has had a single-day record death toll from the virus, higher than New York's number, they have reopened their state parks and golf courses. But a look at the economy in these reopened states shows some concerns. When you look at the metrics of hours worked, sales, traffic, restaurant reservations, they all point to levels dramatically below pre-pandemic levels. So people really, in many of these reopened states, still deciding for themselves and still very wary about going out. Some good news about remdesivir. That is an antiviral drug. The FDA gave it emergency approval on Friday. This is a drug that really reduces the recovery time from the virus from 15 to 11 days. It's not a knockout drug, and it doesn't change the fatality rate. Neil, back to you.
Steve, it is a sign of hope, though, to your point. Thank you very much, my friend Steve Harrigan in Atlanta. Much has been said and written already about remdesivir and whether Gilead Sciences is onto something here, or whether this could be akin to what we had with dealing with the AIDS crisis back in the 1980s. No cure for AIDS ever since that time, but a number of treatments that keep people alive. In other words, prevent them from dying. That's what they did with HIV, and that seems to be the point, or at least the hope here with remdesivir. Mark Meredith at the White House with a lot more. Hey, Mark.
Good morning to you, Neil. President Trump is spending the weekend at Camp David. Nothing on his public schedule, but he said he would be speaking with some foreign leaders. It's possible that during those calls, the topic of how this virus got started may come up. Our chief White House correspondent, John Roberts, reports that the U.S. Intelligence Committee, the majority of it, believes that this got started in a lab in China, but that the release of this virus was an accident, not intentional. The investigation is still ongoing. Now, before he left, the president invited the head of Gilead Sciences to the White House. The FDA granted emergency use of the company's drug remdesivir to treat COVID-19 patients. Clinical trials have shown the drug shortens the recovery time for some of those patients.
We're going to be having some really incredible results. We have very promising studies coming out on the vaccines. We have promising studies coming out on therapeutics. And the first one is from Dan and Gilead.
For those of us who've worked in viral diseases and pandemics for a long time, this is our first really positive step forward. It's our first step forward.
Now, the White House also continues to monitor the economic fallout of all this. The April's jobs report, that is expected to come out next on Friday, and it's expected to paint a very bleak picture of the employment situation nationwide.
You're going to see some economic data over the next few months that's as bad as you've ever seen. You know, we turned the economy completely off, which is something that just hasn't ever happened before. And so you are going to see a very big increase in the unemployment rate, a very big decline, as Larry Kudlow mentioned, in second quarter GDP. But most forecasters expect the second half can rebound from that. And the sooner we get going, the more likely it is that that'll be true.
The White House trying to remain optimistic that the jobs numbers will bounce back, but the unemployment rate could be between 16 to 19%. Also want to mention on Friday, President Trump was asked about the pictures coming out of North Korea with the state media there showing Kim Jong-un back out in public for the first time over those health reports. The president deciding not to comment on at this point, but we're going to be continuing to watch over the weekend to see if he has anything to say on Twitter. As we mentioned, the president not here at the White House today, but up at Camp David. Neil?
All right, Mark, thank you very, very much. Mark Meredith at the White House, the president, as he said, at Camp David this weekend. Now, in the meantime, much has been made on what is it exactly that is so many scientists, doctors excited about remdesivir. The fact that it can accelerate the recovery in extreme patients, those, for example, who are on respirators and ventilators, that's an encouraging development and one I want to raise right now because a lot of the studies that have come out on this and showing that ancillary benefit have come out of the University of Nebraska. Nebraska's governor right now joining us, Pete Ricketts. Governor, very good to have you. Thanks for joining us.
My pleasure. Good morning.
Good morning to you. Governor, what was interesting about that University of Nebraska study, I guess done in concert with your state officials, AstraZeneca, a host of others, is that it did seem to show promising possibilities for those with severe cases of coronavirus. And I'm wondering whether those findings might have tipped it in favor of the FDA getting involved and granting emergency approval for use in such patients. What do you think?
Well, it's certainly possible. I mean, the University of Nebraska Medical Center is one of the world-renowned organizations with regard to infectious disease. We've got the Biocontainment Center, the only federally funded quarantine center. So we really do have some great experts and minds there that are working on this problem.
Monday, I guess some of your real easing provisions kick in, Governor, like elective surgeries can resume, partial openings. Can you update me what's happening, I guess more to the point next week?
Sure, absolutely. So we have relaxed some of our directed health measures to allow for restaurants to go to 50% capacity in about half the state's counties, a little bit more. We also will allow elective surgeries. We're going to allow worship services to begin again in larger than just 10-person groups. So we're going to be taking some steps. There were some targeted businesses we closed, like salons and tattoo parlors and massage therapy, that will be able to open under the 10-person rule. So we're going to take a step to be able to start opening things up again. But we also have counties where we've got, still a lot of hot spots, we'll call them. And so we're going to keep those under the previous restrictions.
In the meantime, Governor, you're no stranger to what's going on with meat processing plants across the country. You have quite a few in your state, a big beef state, a poultry state as well. I'm curious, given the fact that the president had demanded these stay open and some workers at these facilities were concerned for their own safety, the measures taken or at least offered by the president ease their concerns, or are they still scared?
Well, I think this is in line with what the president says about responding to emergencies like this in general, which is federally supported, but state managed and locally executed. So for weeks, we've been working with the food processors to be able to put social distancing in their plants where admittedly it's very difficult. We're also working with communities because a lot of the folks who serve these meat packing plants, for example, are in communities where English is not the first language. They may be more densely populated in their homes. It's tougher to socially distance at home as well. And so there's some number of challenges that we have to address both in the workplace and at home. And we've been working very hard these last several weeks to be able to do that. I think the president's announcement gives needed support to why it's so important that we keep these facilities open so that we have a strong food supply chain.
But do you think those workers are safe? I certainly see the need to keep the food supply chain going and the beef supply chain going. But a lot of those workers, I've talked to more than a few, Governor, have said, am I being forced to go back? If they don't want to go back, if they're scared for their safety, do they have to go back?
Well, of course, nobody's going to be able to force them to go back in. I think part of what we've been working on these last several weeks with the facilities is to be able to put up things like plexiglass between workstations, be able to separate out so people can eat, separated by plastic at lunch, that they're testing everybody coming in, taking temperatures, that in fact a lot of these plants are doing short-term disability for folks so that they can stay home if they're sick or if somebody in their household sick, paying them 2 weeks if they're sick. So these facilities are all really making great strides to be able to find a way to socially distance in an environment that it is very difficult to socially distance. I mean, nobody's going to deny that. And, we have our own folks from the University of Nebraska Medical Center who are touring these facilities. They've toured 11 to date and offering solutions on how they can improve their air handling, systems, put up more hand sanitizers, have people put on their PPE in different places so to prevent the spread of virus. So we're working collaboratively with our experts at UNMC to be able to help these facilities. And like I said, we're reaching out to communities. We put videos. I do press briefings in Spanish to be able to help get the word out. We put videos out in multiple languages. So we're working very hard to get the word out, not only about work, but also about home and doing social distancing.
Are you optimistic that our meat supply is safe, Governor? I only say it because I know that the Food and Drug Administration read on this that you can't get coronavirus passing through food from those who've been infected with the virus. But the FDA in the past has changed its views on similar subjects. So I'm just wondering, is anyone or on your staff or their medical teams looking at that issue about the safety of the meat when hundreds of workers, I'm talking about, across the entire country at meat and pork processing plants and the like, have been infected with this virus? Are you absolutely certain that the meat supply is safe?
I am absolutely certain the meat supply is safe. This is a respiratory disease. It's spread by people coughing and droplets in the air. It is not spread. It's not a bloodborne disease. It's not something that, for example, mosquitoes can spread. It's not going to be spread in the meat. I mean, this is something that is absolutely safe. What we have to work on is the health and safety of the workers to create, work with those facilities to be able to make sure they've got an environment they want to come to work in, and that the workers are also taking the same sort of steps at home to be able to socially distance and spread the virus there, because, again, it's a respiratory disease. If you're in a situation where you got multiple generations of people, a lot of people in a household, that's how the virus is going to spread, not through a meat supply.
All right. From your mouth to, and all the other top medical minds who say pretty much the same thing. We hope that is the case. Governor, thank you so much for taking the time. Best of luck in this gradual reopening of your fine state. All right, Governor Ricketts of Nebraska. We want to take your attention to what's going to be happening over the skies of Baltimore and Washington later this afternoon. All right, certainly a lot of hope for this remdesivir, this drug made by Gilead Sciences, so much so that the CEO was invited to the White House yesterday and had a chance to outline the significance of this discovery now that the drug could at least accelerate recoveries, especially in hard-pressed patients, COVID-19 patients that might be on ventilators and otherwise in a very, very tough situation. Dr. Marty Makary joins us right now, Johns Hopkins School of Public Health, also a Fox News contributor. Doctor, good to have you back with us. Are we getting ahead of our medical skis on this? Hope springs eternal, and everyone hopes that this is something that can really bring hope to a lot of folks. But what do you think?
Well, this is one tool in the toolbox, Neil. I think we're going to see a lot of tools coming out in the next several months. I mean, this plus a vaccine, plus mitigation, plus distancing. There's a lot of stuff out there that we can use in combination. And the reason we're so excited about remdesivir is not that it's a silver bullet or that it's useful in prophylaxis or preventing the infection, but that it helps us in patients who are very sick, those who are ventilated. And although this study showed a 31% reduction in the hospital length of stay, it's actually an observation from a paper a week and a half ago in the New England Journal of Medicine that the mortality or death rate among those ventilated was 18%. If you can think of Andrew Cuomo talking about a 70% or 80% death rate among ventilated patients, that's an interesting early observation. So this could be really helpful in the sickest patients.
A doctor is noticing that there are a number of possible treatments and or vaccines or that's drugs that could take some of the more problematic symptoms associated with this. Moderna is looking to make a potential vaccine as early as July. I don't know where that stands. Obviously, we talk about Inovia as well. It's expanding, manufacturing of a COVID-19 vaccine candidate. In the UK, working with Oxford right now and AstraZeneca on some effective treatments that could be ready by the fall. So there's a lot percolating and going around. But timing is everything, right? Is it your sense that something is possible before the end of this year?
Well, we certainly could have a subsample of these vaccines in time to vaccinate some people in the United States. And we know the one profession that is at the highest risk of getting the infection is my profession. It's healthcare professionals. And so there are plans to try to get enough supply to vaccinate this subgroup. And after all, you've got to test it in a population not as much for safety at that point in the development, but more so to see if it really mounts the antibodies or the immunity that you hope for. The Oxford company is the one you mentioned in the UK is already shown immunogenicity or immune response in animals. So they've got plans drawn up already to start their supply chain. And our new Warp Speed project the White House is working on will do the same, actually start manufacturing before we get the final results in case they are positive and useful.
Doctor, I always ask as we get together here, but what do you think of this unwinding of provisions in different states is going as more and more states begin to open up, albeit tentatively, cautiously, I think quite judiciously, but do you like what you're seeing or any worries you have? Some states have moved before the numbers would warrant such a move, but so far, so good. What do you think?
Well, I am concerned, Neil, that we are still seeing an increase in about 25 states. That's data from this week. So the idea that we are going to have what they call a classic symmetric epidemic curve, which is a rapid, steep increase and a rapid decline, that has not been our experience here, and that is concerning. Those models, and the reason the models were wrong is that they were based really on the Chinese data as the data came in, but we are having an experience more like Europe where our plateaus are prolonged, our peaks are stretched out, and so we're seeing that right now, and that's our concern in public health is that we may have to adopt a new normal, and we may not be getting rid of this. This may turn into a chronic problem as we go into this summer and fall.
How long do you think, just advising from your medical expertise, doctor, would you advise people stick to some sort of distancing rules? Restaurants still adhere to limited capacity rules, whether they're at 25% as they are in Texas or 50%. How long would you suggest they do that?
Well, I would say until further notice, because, Neil, we were hoping to be in a much better place right now, given the extreme measures that we asked people to change in their routines, and we're just not seeing the rapid declines we were hoping. If you think about 800 patients admitted to New York hospitals on Friday, how did those patients get the infection? They got the infection during the extreme mitigation, so there is leakage. At the same time, I don't personally think that government should be in the business of telling companies that they have to open or close. Instead, I personally have the view that the government should be issuing guidelines and mandates on distancing and hygiene, and then businesses can figure out whether or not they can comply with those mandates.
Yeah, that's a very good point. Doctor, thank you very much. Marty McCary, I want to thank you, doctor, as well, for doing yeoman's work and not getting much sleep in the process. So thank you very much, very much. That goes to all the healthcare workers and those who are looking after us. Dr. mentioned something interesting about businesses don't necessarily have to comply. We're already seeing that in South Carolina and Georgia, where a number of big businesses are saying, I know you say it's okay to open up. We'd rather wait, see how this goes. So it really depends on the state and the business. Stay with us. You are watching Fox News. You know, the one thing we're following as states begin to slowly reopen across the country, or at least dip their toes in the water here to sort of ease up on those stay-at-home provisions, is you never know when is the exact time to do it. Take Maryland, for example. It reported 1,730 confirmed cases of coronavirus yesterday. This disrupted what looked like a steady trend and an improving trend. It probably could explain why Republican Maryland Governor Hogan has said, I'm going to keep these provisions in effect a little while longer, see how this sorts out. Let's see if the state senior Senator Ben Cardin agrees with that strategy. Senator, always good to have you. He's holding off. The governor's holding off a little while here because not just the spike in cases, but concerns. He doesn't want to rush it. He wants to see more favorable data, probably more testing. How are you on that?
Well, Neil, I think the governor is following the best advice he can from our public health officials, so I support the governor's decision. I really do applaud the efforts of the people of Maryland. They recognize that this is still a very serious disease in our state. It is still spreading. We have hot spots just this past week on the eastern shore of Maryland at one of the processing plants. We had numerous cases. We have problems in some of our confined facilities, whether they're nursing homes or penal facilities. We recognize that we still have a serious challenge in our state. So, yes, I support the governor.
You know, hospitalizations have improved, I should separately say, and that's why a lot of protesters have been saying of this governor, of your governor, that wait a minute, I mean, if you wait till everything's perfect, we'll never reopen and we'll lose everything, our economic well-being, our jobs, you name it. So how do you balance that?
No, I think that's an excellent point. We're going to be reopening, and I do applaud a lot of the businesses who have already made plans for a safe working environment for their workers. The key here, though, for government is to have a greater capacity on testing. We need to make sure that our workplace is safe. We need to be able to trace those who have the virus. So testing is a very important component, and we're not where we need to be. The other is protective equipment for our first responders, for our healthcare workers, and for those that are in positions where they need to have protective equipment in order to stay safe. So they're the two ingredients that we really need to put on all court press to get so that we can open in a safe manner.
You know, there's been a lot of talk about aid to the states, Senator. I don't know where you are on this. When I caught up with Mitch McConnell, the Senate Majority Leader, earlier in the week, he seemed to bend a little on this idea that states could always apply for bankruptcy by saying, I'll help them out if they accept something regarding liability protection for businesses. I want you to listen to this, and then I'd love you to react to it. This is Mitch McConnell.
What I'm saying is we have a red line on liability. It won't pass the Senate without it.
So what would happen, though, Senator, if a business feeling that it is emboldened by liability protection, that it doesn't do some basic things like masks and other protections for workers because it might feel that it's legally bulletproof and doesn't have to?
Well, it's a good question. I mean, you have to carefully craft the liability protection to deal with the money that would be supplied to state and local government, conditioned upon them enacting at the state level the kind of legislation that would provide liability protection for those who are seeking to go forward and to get the economy back up to work.
Senator Cardin, what do you think of that? Liability protection?
Sure. First of all, I don't like red lines. I really do think that this is a time that we need to work together in a nonpartisan, bipartisan manner, and that we shouldn't have red lines. We should certainly sit down and negotiate. Clearly, a lot of these issues are state issues, not federal issues, but we need to make sure that states have the resources to provide the essential services, whether it's police, fire, their healthcare workers. The local governments today have had a tremendous loss of revenue. They have to balance their budget, and the federal government needs to be there as their partner. So I was pleased to see that the president acknowledged that he recognizes that we need to do more for our state and local governments, and I hope that will be certainly part of our efforts in the next couple of weeks. The liability issues are a little more complicated. That's really a state issue. So I would hope that we would be able to sit down and negotiate and come up with a package to keep Americans safe and help our economy reopen.
Senator Mitch McConnell also said he's not keen on an infrastructure package right now. Many Democrats, including the president, by the way, are keen on that. He is saying it's not a near-term issue for him. Is that your thinking?
Well, before COVID-19, we had a bipartisan agreement, a unanimous vote in our committee for an infrastructure bill. One thing that the COVID-19 has underscored is the need, for example, in connectivity. Too many homes do not have access to broadband, high-speed internet service. So we really need to deal with the infrastructure of America, whether it's roads, bridges, our internet service, or whether it's our water infrastructure. This coming week, the committee I serve on is going to be acting on a water infrastructure bill. We got to move those bills forward for our country. And by the way, it will help build our economy as well. So it's really a win-win situation. It's certainly bipartisan, and we hope that it'll be part of our efforts in the next couple of weeks.
Senator Cardin, be well, be safe, your family,
Thanks.
your constituents. Senator Ben Cardin, the beautiful state of Maryland. Let's hope they do get back up and running and soon, safely. In the meantime, we told you about all these states after states that are now saying restaurants can reopen, albeit tentatively, albeit slowly, some as little as a quarter of their normal capacity. How's that going to work? I guess it's better than no capacity, but how do you do that? John Taffer, remember him? After this. All right, getting ready to hear from New York Governor Andrew Cuomo here. There was a spike in cases in the city, certainly. I don't know if it extended to the state, but he is addressing what now is next in New York's plans. You know, he has talked about a staggered opening, that the more rural upstate that's been less affected by coronavirus cases would open before, let's say, downstate, including New York City and the 5 boroughs around Manhattan. He might hint at that. He's already decided that schools are closed for the rest of the year in New York. But he has not really signaled what would happen after the 15th, when a lot of these rules that are in place now are set to expire. He could extend them another few days or weeks. We have no idea. We got a hint out of New Jersey that they are looking like they will be extended a little bit, even though New Jersey Governor Phil Murphy, who met with the president earlier in the week, did open up the state's parks, playgrounds, that sort of thing. So that might be a signal what he is planning to do and whether he would go beyond the 15th or what have you. But when the governor speaks, we'll take you to him, at least give you some of the updates and share them with you. In the meantime, a lot of folks in the Washington area, the Baltimore area, and later on in Atlanta, Georgia, are going to be looking to the skies because they're going to have quite a show over their heads. Lucas Tomlinson has more from Washington. Hey, Lucas.
Hey, Neil, the flyovers were such a big hit earlier this week, the Pentagon said, let's do it again.
I hope each of you will take a little time this Saturday to step outside and join the tribute to our frontline medical workers in a responsible, socially distant manner. I especially want to thank General Thomas, Ed Thomas, who helped push this initiative.
Today's flyovers kick off over hospitals in Baltimore in about an hour at 11:30. The Blue Angels and Thunderbirds will then fly south over I-95 to Washington, D.C., beginning at 11:45 over PG County Hospital in Maryland, then over Northern Virginia, and then over the National Mall just past noon at 12:05. The formation will then fly south over Atlanta beginning at 1:35. Earlier this week, the Blue Angels and Thunderbirds flew over New York City, Newark and Trenton, New Jersey, as well as Philadelphia hospitals to salute the first responders, today's heroes on the front lines in this battle against the coronavirus. The Air Force also flew this B-2 stealth bomber over Kansas City hospitals earlier this week, along with 2 tank-killing A-10 Warthogs and 4 T-38 training jets, all from Whiteman Air Force Base in Missouri. And these B-52 bombers from Global Strike Command flew over the Big Easy in New Orleans, escorted by F-15s from the Louisiana Air National Guard.
It's been very challenging to come to work every day knowing what we're up against.
It's tremendous. It is absolutely tremendous. I mean, the outpouring of love and support from the community has just been amazing. And to do something like this is just, it's special.
We'll have more on the flyovers later today, including one over the South China Sea, Neil.
All right, you're going to have to skedaddle out of that office of yours, young man, to see this later on today. Good seeing you again, Lucas Tomlinson at the Pentagon. All right, you know, we told you about all the unwinding going on in the country and the restaurants, bars, and that sort of thing that can open in some of the states where that's being allowed to happen, but with the catch that quarter, maybe capacity, up to half capacity, depending on how they're doing. You know, Bar Rescue host John Taffer was way ahead of the curve on this, saying it's going to be a big adjustment, not only for, you know, average patrons, but the restaurants themselves. He joins us right now on how he expects this all to go. Good to see you again, John. But what do you think? Starting in, I think in the case of Texas, as little as 25% capacity when you kick it off. What do you think?
Well, thanks for having me, Neil. 25% is a big difference from 50%. You know, restaurants have fixed costs, rent, insurance, various fixed costs that aren't revenue-based. Those costs can run about 30%. Labor runs 30%. Food runs 30%. I'm up at about 90% now. Neil, when revenues drop below 50% of potential, none of the percentage costs work anymore. So think about this. It now would take me 4 hours to serve 100% of the people it used to take me an hour to serve. Think of the additional hours and labor I'm expending to facilitate that, Neil. Think about the added utility cost per guest, which is 3 times if it's a 25%. So I don't see any way that this model can sustain itself unless there's huge delivery numbers to support it. So we have to get restaurants to a point that customers wear masks and behave safely enough that we can create a denser seating environment. And Neil, when I see guests not wearing masks, that concerns me. And I've seen some of that in Atlanta. When you look at in Indiana, they're going closer to 50% seating, but nobody's allowed at a bar at all. No walk-up, no seats at the bar. And the bar, Neil, as you know, is far more profitable than food is. So we've taken away the most profitable product. We've reduced potential by 75%. So the question becomes, what do restaurants do, Neil? Do they open and tolerate and get through this and just try to sustain themselves? Or do they sit and wait until profitability can be more assured because capacity is higher? It's a very tough choice, Neil. Nobody's going to make money in this current scenario. The issue is, how much do we lose?
How do you woo customers back who might be leery themselves about the safety of all of this? I have no doubt eventually they'll come back, but it could be slow going, couldn't it?
Oh, I think so, Neil. In simplistic sense, I think a third of the marketplace will come back pretty quickly. The second third I call reserved. They're going to watch the first third. They want to make sure there's no surges. They want to make sure things are going well. Then that second third will ease back in a few weeks later. The third third I call the certain third. They're the older demographic, people with pre-existing conditions. They're not coming out until they know that they're safe, so that there's a vaccine or some other mechanism in place. But, Neil, that tends to be the older demo, tends to be a more affluent demo. So it takes a pretty deep impact upon a luxury sector when that certain group holds back. So that's the kind of flow that I see going on. And I see luxury restaurants, upscale restaurants, possibly suffering more than casual dining.
Well, John, I'm telling you, you have been way ahead of this curve in all the things we should be watching. And anyone who's not catching your show, it's entertaining. They should also know you know what you're talking about. So, John, thank you again for that. Continued success, and thanks for helping a lot of people out. You're giving them very good practical advice. John Taffer, or American Bar Rescue. I should also update you here on all the companies that are doing things to sort of recognize our healthcare workers. But Krispy Kreme and its CEO, they seem to top a lot of them lately, but by offering free donuts to these guys, and not just 1 or 2 at a time. How about a dozen? Wow. Leave it next. Let me ask you something. Would you wait hours in line to get your hands on a dozen Krispy Kreme donuts? I frankly would wait months. But the fact of the matter is, it's a big lure, and it's meant to help healthcare workers and those first responders who are doing everything and anything they can to help out. But it's a twin need here on the folks who are really looking forward to a delicious donut, and others who are just looking forward to a little relief from stay-at-home provisions that after a while, you know, gets you. Mike Tattersall is the Krispy Kreme CEO. He joins us right now. Michael, good to have you.
Hey, great to be here, Neil. Thank you very much. I hope you're well.
Did you come up with this idea?
You can see behind me, we've got our B-Suite Saturday going on.
It looks great. Now, what got this whole thing started?
About 8 weeks ago, when this pandemic really started to kick in, the team and I started to work on acts of joy. And what we mean by that is, what could we do and operate safely? And making sure that our donut shops and commissaries and all our Krispy Kremers, that's what I call folks that work at Krispy Kreme, can do. And some great ideas came up. One you're seeing now is an act of joy called B-Suite Saturday. And what that means in the world of contactless delivery, our neighbors can come by and pick up, if they order a dozen, they get another dozen free, and they can use contactless delivery instructions and drop it off at their neighbor. And that's just one of the acts of joy that came through, but we got plenty more. And a lot of these ideas, Neil, came through. I visit shops all the time. You can imagine in the last 8+ weeks, I've been visiting shops with a real focus on safety and just making sure all of our Krispy Kremers can feel confident to be able to deliver the Joy, which comes with Krispy Kreme. And when I do that, they'd actually started to send me on community drops for them, which I found pretty interesting. So I'd go there, we'd look at safety, make sure we're operating right, because the operating regulations changed all the time. And eventually they'd send me to the community. I started noticing a pattern. Almost every single shop or commissary would send me to the healthcare place. So I'd have to go in gloves and with a mask. And I could see that they really appreciated it. And I started paying attention to all these little data points. And I go, it's fantastic. The healthcare folks are really appreciative of it. And we just needed to figure out how to scale it. So we put that to our teams, and our teams came up with our Healthcare Mondays. And basically that means if you're in the healthcare business, you can come on Monday. All you got to do is show a badge, and you can get a couple dozens free from Krispy Kreme. And so that idea came from, our shops, and then we scale it, right? And to date, we've actually delivered over 13 million donuts to the healthcare business.
That's beautiful. And so hypothetically, if I show up and you say you order a dozen donuts, you get a dozen free, then if I order 5 dozen donuts, I'll get 5 dozen donuts free.
If you're in the healthcare, yes. The lines are long, so actually the healthcare folks are pretty generous with each other. They know that they're taking up a lot of time, right? So they tend to take about 2 dozens.
Got it. It's a beautiful name, delicious thing. Mike Titusfield, thank you very much. The Krispy Kreme CEO. It's a very thin CEO.
Thanks to all the Krispy Kremers. Really appreciate everything they do every day.
I bet you do. Thank you, sir. We have a lot more coming up, including those who were honored by the President of the United States this week. Heroes who maybe aren't your first thing you think of when you think of heroes, like this young lady. After this.